We're sort of a broad spectrum practice here, so we see virtually all subsites of disease, all kinds of patients, except really for pediatric patients who would probably be referred to a high-volume pediatric center. But everybody else we see and treat. Obviously, most common things being the most common things, we're going to see a lot of prostate patients, breast patients, lung patients, those kinds of things. We do a lot of highly conformal external beam radiation plans using techniques like IMRT is one. It's a very conformal plan that helps reduce toxicity to surrounding tissues. We've recently, over the last year, really started ramping up our stereotactic program. So SBRT, which is stereotactic body radiotherapy, allows us to treat early stage lung tumors with very high cure rates that are comparable to surgical resection without the surgery, which is very nice. So we've been seeing increased volume there and really some great outcomes for those patients. We treat everything from palliative cases for comfort to curative cases where at the end of treatment, if all things go well, that disease is gone. Patients have a lot of things on their plate when they first come in, and it's hard for them, I imagine, to keep it all straight and organized and remember, I have to see this person this day and that person that day. So we try to minimize that burden for our patients so that they can just sort of let things flow and we'll get the rest of it taken care of for them. But they're going to meet the radiation oncology team, which is going to be everybody from our front desk personnel to the nurses to the radiation therapists, myself and my colleague Dr. Jensen. They may actually not meet, but there are physicists and dosimetrists who work sort of behind the scenes that make the magic happen, working on the plans and making sure things are being done safely.
And the doctor will come in and outline the area he wants to treat. So then we add radiation beams in different angles to avoid healthy structures to get a good dose to that site the doctor wants treated and to avoid all the healthy tissues or most of the healthy tissues nearby. The physicist's role in the therapy department is mostly collecting beam data on your treatment machines, getting it into the treatment planning software, make sure it's all accurate and really depicts how the machine acts when the patient's in the room. All those calculations get exported into our computer system, Mosaic computer system that we use here in our department. It's very specialized. We use it for scheduling all our patients, and it also has a record and verify feature. So the therapist can download the treatment field right into the treatment machine. It'll set the field size, it'll set the angles, and if everything isn't set up just like this plan, it won't let them turn on the machine. It'll tell them what's wrong, and they'll have to fix it.
I think one of the things that sets us apart is just the level of care and how important it is to our employees that our patients are happy and comfortable. Our therapists do an amazing job at establishing, a relationship with the patients. Our nurses do a great job of really taking care of the patients every single day and, establishing, again, a really close relationship. I'd like to think that my colleague and I also do the same thing. Certainly I enjoy seeing the patients. And then in addition to that sort of community feel, I really do think we have some great technology here in our department, and we're able to provide very cutting-edge treatments with decreasing toxicity that just gets better all the time. And then there's the Dempsey Center just down the hill, which is completely free for patients, and they have a lot of amazing support systems there. They've got a library, they've got a computer lab, they've got dietitians, they've got social workers who really do a great job with regard to grief counseling and those kinds of things. And we have in-house social workers as well who have been just outstanding in helping patients with financial difficulties or insurance problems, transportation issues, housing issues. If somebody's from far away, which, let's face it, we're in Maine, things are far apart in Maine, and patients sometimes have to come a long ways, and we've got shuttles that can run We've got the Arbor House, which is a free housing and lodging facility directly across the street from us, with little apartments and kitchenettes and things, nicer than anything I lived in when I was in medical school. So, you know, that's available. We're also exploring other things that are available here within the hospital through clinics like integrative medicine that has things like acupuncture potentially to help our patients. The Dempsey Center has massage therapy. So there's a whole host of opportunities out there for patients to take advantage of, and we try to direct them in those areas, but if patients have particular interests, we're likely able to provide that.